have noted few challenges thus far, from the previous, speakers, one or two or three. I see people, nodding their heads. Definitely, we have, noted them, and we'll talk about them as we go along, and see how jointly, we can, work in a solution, towards, rendering, good services, in terms of adoption services. I'll start with the Children's Act. You may know that the Children's Act was promulgated and it was put into effect it was implemented in 2010, and considerable progress has been made since then. It was developed in response of international and national reforms that took place to ensure a holistic care and protection of children. The introduction and preamble to the Children's Act embodied the international and national obligations, to protect the children, and then, to reflect the holistic developmental approach in terms of, the inclusivity, in terms of providing services to our children. That is, our Bible in terms of where we need, to move from. In terms of the policy context, we considered, the following: the Constitution, in terms of the legislation, the white paper, and also, the global, commitments. We've heard from the previous speakers about the United Nations on the right of the child, the African on the position, of the child, the Hague Convention, etc. So those are the things that we have, taken into consideration in terms of improving services, to children, but mainly on adoption services. We need to pause, a little bit and look at what have we done, thus far. What have we developed, since 2010, in terms of, the guiding, documents, the strategies, the practice guidelines. So we have, adoption policy framework and strategy. This was, a piece of work that we didn't have, previously. Adoption has been there, for years, as you may know, but there was no solid, kind of, strategy or a framework that has been, put, in place. We are having practice guidelines on national adoptions. We are also having, guidelines on RECAP. We have heard, about, challenges in terms of RECAP. We'll hear about that, as we go along. But these are the things that we have developed, since the implementation of the Act. We also have practice guidelines on inter-country adoptions, assisting, officials or the practitioners in terms of how should they go about, in rendering inter-country adoptions. We also have accreditation guidelines for adoption service providers. As you may know, this is a requirement, by the Act that adoption service providers need to be accredited. So we have developed, accreditation, guidelines, to look at, how should, we go about. And also, working agreements. As you may know, we have bilateral agreements with various international, countries in terms of inter-country adoptions. Starting with the RECAP itself. You may know that is Section 232 of the Act. It requires, that the Director General, keep and maintain, this kind of register. This register is the Register on Adoptable Children and Prospective Adoptive Parents. Professor September alluded upon that we may be talking about so many children who are adoptable, but they are not registered in this kind, of register. What we are doing, we are talking, to service providers, we are talking to the social workers, in the provinces, to say, please provide, names and feed, the register, with details as required. In terms of still, the register, it came into effect by April 2010 as a tool to be used to facilitate the adherence of, the subsidiarity principle. We know that we need to exhaust, local, avenues first, trying to place children, locally before opting, for inter-country option. Currently, the National Department of Social Development uses a manual. We are still using, the manual system. It is not yet, IT, developed. The directorate's IT, with our directorate, we are working, hand in hand, to fast track this. And the system will be piloted, after, this, so that we can see as to, how, can we, effectively, utilize, the IT program. In terms of the statistic, you have noted that these are the numbers, and I put them, purposefully from 2010 up until now. But from the presentation by Professor Julia, you would have, noted, the previous years. Because, my parameter, my focus was, in terms of the mandate, after the implementation of the Act. In terms of accreditation, accreditation of adoption service providers has been implemented since 2010, as stipulated, by the Children's Act. The first duration period lasted from April 2010 to March 2015. Most of you, the private social workers and also, the child protection organization would know that you were engaged, in this particular, process. The renewal was done in April 2015, that is last year. And you know that, it's a duration for 5 years. Is this 5 years, 4 years? It's for a duration of 5 years, yes. First accreditation, process was, it was something that, was a learning curve, for both of us, as the national department, because this is the national mandate, and also, the social workers, the service providers. So applications, were, sent, delays were made, but ultimately, a total, I can say for now, if not mistaken, a total number of social workers in private practice that have been, accredited is 53, and, the child protection organizations is, 58. So that is, the latest that, I got, from the records. Still, in terms of, okay, this still talks about accreditation, and then in terms of the intercountry. Intercountry is a practice, governed by the Hague Convention, 93. We have heard, from Professor Julia about the accession, of, our country into that. The convention emphasized the principle of cooperation between the states, to work together. And the Children's Act definitely stipulates or provides. It has, some provision in terms of, the working agreement with an accredited adoption agency in the country, and, with foreign adoption agency, and also, the collaboration and the interaction amongst or between the two central authorities. So South Africa also maintained inter-country adoption cooperation with the non-Hague countries. So we'll see as we go along as to what do I mean. Inter-country adoption became a reality since the year 2000. Section 18.4, subsection 4 of the Child Care Act, was found to be unconstitutional as it didn't allow, South African, citizens who are not resident, in the country to adopt. So as a result, the Law Commission recommended that, the Central Authority become a member, to the Hague. So ultimately, DSD became, the Central Authority to monitor and control all, inter-country adoptions, that are taking place. You may ask yourself as, which countries are we having working agreements with? Amongst others, is the Netherlands, and I have put, the country on the left-hand side, and also, the Child Protection Organization. According to the Children's Act, the child protection organizations are the ones who are to undertake inter-country adoptions. So we have, tried to evenly, spread, the CPOs amongst the countries, and the following are the countries that we have, working agreements with: the Netherlands, Norway, Sweden, Germany, Finland, the US, Australia, Belgium, France, Canada, Luxembourg, Austria, Denmark, India, and the UK. And there are developments, thus far, in terms of the amendment of the Act that I needed, to talk to, that the provinces and us, as National Department are engaged with. The department reviewed the Act in 2011 by consulting various stakeholders, and amongst those various stakeholders is yourself, with the view of amending it, because there were challenges that were observed in terms of the implementation thereof. This culminated in the drafting of the Children's Amendment Bill, as well as the Children's Second Amendment Bill. Submissions have been made and they have been deliberated upon. Firstly, by the Parliament in the big house, that is the National Assembly. And then currently, as we speak, 2 weeks ago, the public hearings, started by the Eastern Cape. They will, go around, to cover all the provinces, and thereafter, a decision will be made, by politicians, to take matters forward in terms of what we have proposed. But from our adoption units, from our adoption side, you will see what we have, proposed. Currently, as I say, the Act, does not make provision, for the departmental, social workers to provide, adoption services. According to the Act, the social workers in private practice and, the CPOs are the ones currently, who are allowed, to do that. And earlier on, we have heard about the dropping, of the figures. One of, the factor that could be, attributing to the drop of figure could be in terms, of accessibility, of adoption services. Previously, people were, having, access to, adoption services. But with the Children's Act, restrictions were made, and we have noted that gap and made proposal to include the subsection C in terms of opening and, taking cognizance and recognizing, that definitely, DSD social workers could also, be in a position to undertake adoption services. The aim is to close the gap or omission between the Act, and there are implications in relation to this. DSD, need to have dedicated staff right away, down to the district local services. You may be aware that we have identified social workers, your provinces have identified you guys as people who would be rendering those adoption services, and some officials, from the unit, national unit, has, started going out to the provinces, to capacitate, so that, they can, make you ready in terms of, the service. We also requested, the provinces to provide or to submit their readiness implementation plan. Indeed, they did. And yeah, we are working on that. Furthermore, there is a big policy on child protection. This policy, emanated from a need of, a comprehensive policy underpinning child protection, underpinning, the Children's Act. This policy reflects a holistic, view of, our care and protection, looking at the developmental, preventative, and regulating, the relationships, and the parental, responsibilities and caregivers. It is envisaged that, some of the children and families with special needs will be considered. So, child care protection policy therefore underpins the Children's Act, and it will give expression to South African commitment in terms of care and protection of our children. So these are some of the things that have been, done since, 2010, after the implementation of the Act, up until now. There is one exercise that you have been, involved in, that is the review of child protection system. PACT, as an organization in partnership with other organizations, is implementing what is called, government capacity building and support program in collaboration, with the National Department of Social Development. The department and child protection organizations have been, part of this, and are to respond, to, matters that need particular attention and improvement. However, there are challenges in terms of delivering, some of the services that we have, noticed as we go along. And this assignment, of improving the child's, the child welfare system, it will provide, some mechanisms in terms of enhancing, the quality of alternative care, in South Africa, and particularly for us, in adoption services. Improvement plans have been developed, and these improvement plans will be used ultimately to ensure that the findings from the desktop scan that has been undertaken will be translated into actionable, recommendations. It will also provide a framework for monitoring the implementation of identifying gaps so that solutions, could be made, and provide and keep relevant stakeholders, up to date. We have a forum that we call National Child Care and Protection Forum. Some of you, are, members, are standing there, are sitting in that platform. So we provide, feedback on regular basis in terms of the updates, that are taking place in terms of, focus areas. And then, in conclusion, much has been done since the implementation of the Children's Act, but I must say there is a room for improvement that needs to be made, by, collective effort, both government, the civil service, civil organization, and also, the social workers in private practice, to strengthen, the adoption services in the country. So, yeah, I think that is what I was required to do.
Hello. Thank you very much, Dr. Mabe.